Hi, welcome to Christine's Corner. Today we have Melissa. Melissa, you want to say who you are and what you do for a living?
My name's Melissa. I'm a critical care nurse in one of the local hospitals in Connecticut. I've been a nurse for almost 17 years, with the last 10 being in critical care.
Have you seen a lot of COVID patients?
Yeah, since March, my unit has been very full with COVID, and it's been an interesting 9 months, or however long it's been.
Were you how were you being prepared, the whole hospital, or where you are? If I could edit that one out, because that wasn't. How many would you say have gone through your care?
Probably hundreds. Back in March, when COVID first hit, the hospital closed down for everything but inpatient stuff. So we didn't have surgeries, they didn't have outpatient procedures. It was pretty much just to handle the influx of COVID patients. And right now, with the second wave and the surge, the hospital didn't close surgeries, but for a couple of months back in March, that's all we had in ICU was COVID. Now we're handling, the COVID plus other things, surgeries that, the patient didn't do well, and so right now it's a mix. So we've been running probably at max capacity, though, for months.
Is there less surgeries because of the COVID? Are they worried about it?
Well, so when COVID happened, back in March, as I said, the surgery stopped, and it was only emergency stuff. And honestly, people were scared, and they stayed away from the ER, and it was very strange. But now, there's people are coming out and having things done that, electively, knee replacement, joint replacements, that kind of stuff. So, people are still scared to come to the hospital for things, but it's kind of, we're trying to act business as usual. So
With this COVID being so drastic, have you seen a lot of patients pass on?
yeah, actually the last couple of weeks, it feels like every patient that I've taken care of with COVID, they've been pretty sick, so I've seen a lot pass away in the last couple of weeks.
That's pretty sad. How do you deal with something like that?
I've been a nurse a long time, so I've seen a lot of things, and I've dealt with death, and I've dealt with that kind of stuff. So I try to disconnect myself when I come home. I try not to think about work. I try not to talk about work. I try not to. I try to find other things to keep myself occupied, because if I brought work home with me, which it's not easy to do, to like disconnect yourself, especially when you're there 36 hours a week. But I spend time with the kids, spend time with the boyfriend, and just kind of try to live my life and try to be safe.
So you try to be safe from when you come home with a COVID. Do you have to change?
Yeah, like back in March, when I didn't know what I was dealing with, I would come home. I sent my kids to stay somewhere else because I was afraid that I was gonna bring something home to them because we were reusing our PPE, and I would come home and I would put my scrubs directly into the wash, and I would take a shower as soon as I got home. I wouldn't bring my shoes in the house, and I would have a change of shoes and everything. Now I still do that. I'll put my scrubs directly in the wash, especially if I know that especially if I've had COVID patients that night, and I'll take a shower. So I guess it hasn't really changed too much. Some people, I used to completely sometimes just change right after I got done with my shift. I would change at work, but that became a hassle. So I just change when I come home, shower, that kind of stuff.
So what symptoms do people have to look out for?
I mean,
if they have COVID?
Honestly, COVID has a lot of symptoms. It kind of is, sore throat, runny nose, cold symptoms. COVID kind of masks itself as like a lot of different things. And right now, fevers and chills and headaches, that kind of stuff. And it's flu season too, so there's a lot of like viruses and things to worry about right now. But interestingly enough, we're not seeing a lot of cases of flu right now. And I think that has to do with the masks and the social distancing and the quarantine and stuff. COVID is a lot more contagious than the flu. And I think we've had, we've been dealing with, normally this time of year, our unit would be full of patients that have flu symptoms and they're flu positive and they're having trouble breathing. But I think wearing the masks and, we're practicing hand hygiene, the flu's kind of taking a back seat right now, which it's not a bad thing, because I don't think the hospital could handle the influx of flu plus the influx of COVID. I think it would be disastrous, to be honest.
How can you tell if a patient's coming in with the flu or COVID?
You can't until you swab them.
So they find out right away?
It depends. There's a couple different tests. There's a rapid one that they say isn't as accurate, but this is a newer virus, or this strain of coronavirus is newer. So it just depends. Sometimes if they send it out, it takes a couple days, but we act like they have corona until we find out otherwise. And anyone that has anything that's could be corona related type symptoms, we automatically put them on as what we call a PUI, and that means that they're like, we're ruling them out for COVID.
Oh. So does every patient come in with the same symptoms?
No, and honestly, we've had people come in for completely unrelated symptoms that, because we're swabbing everybody, we don't feel that they're going to be positive, and then they come back positive. So we've had some exposures because of that, but because we're wearing our PPE, we haven't seen a lot of cases of hospital acquired, in my unit anyways, hospital acquired COVID between the nurses. mostly it's come from the community. When like one of the nurses gets it, they're not getting it from work, they're actually getting it from community exposure.
From community exposure?
Yeah.
When you say PPE, I know maybe most people know what that is, but what is
It's
that?
personal protective equipment. It's we have to wear gloves. We have to wear an N95 respirator or PAPR. We have to wear a surgical mask over that. We wear a face shield. You can wear goggles. You wear a gown. We're pretty much dressed head to toe in protective equipment. Just to keep ourselves safe and to keep other patients safe. We don't want someone coming in and not having COVID and all of a sudden they got it at the hospital. So we try to wear as much as possible. We wash our hands 1,000,000 times a day. We Purell 1,000,000 times a day. So
you're always wearing the equipment because you don't know.
We're wearing the equipment for the most part. There's people that come in and they get tested because they're going to have a surgery, so we already know they're negative. They have the surgery and then they just end up in ICU for some reason. So we don't necessarily wear it with everybody, but we wear it a lot.
Oh, well, that's good to keep being protective.
Yeah.
So far you haven't gotten it, or your kids?
No,
Or
we've been
anybody?
lucky. So we've been fortunate.
Now, there's a lot of people out there that, well, it seems like there's more, a lot, that say this is all a hoax and it's just a government thing. What would you say?
You're going to have those people no matter what. With everything, it turns into political. But, the virus doesn't choose Democrat versus Republican. It can't decide, like, oh, well, this person voted Trump, so I'm going to infect them. Like, I hear that stuff, and it really makes me angry. But, you can't, like, teach everybody, Like, you can't, everyone is going to try to have their own spin and their own opinion, and there's a lot of false information out there because of social media. You can't have, there's a lot of good science out there, but there's a lot of people that have their own opinion and write articles, and people believe that. So it's difficult. You're not gonna convince everybody that there's not a political agenda because they're not in critical care seeing what I see right now. They're not there seeing the people die or seeing the fact that we're doing everything. And yesterday this guy was talking to me, and today he's intubated on a ventilator and on his belly because we can't oxygenate him. So
Wow.
yeah.
That's a big difference from one day to the next.
It is. Sometimes it's 1 hour to the next where you have someone that, they're holding on and they're doing okay, and then they take a turn for the worse.
They bottom out.
Yeah.
That's pretty sad.
It is. Well, and SARS, this coronavirus is called SARS, and it's sudden acute respiratory distress. And it's true, it's sudden sometimes. These people, they're okay, and then until they're not. And it's scary. And these people are scared because they know that this virus is deadly, and
they don't know if they're going to survive or not.
Exactly.
And then they can't see their family.
Exactly. That,
or
like,
friends.
Family, no one's allowed in. If you get admitted with COVID, you're quarantined, you're isolated, and the only people you get to see is the nursing staff or the doctors. And even then, you're seeing people in so much PPE that all you see is maybe their nose and their eyes behind a face shield.
That's pretty sad.
Yeah,
I was going to ask you, so how many days does someone usually stay in for?
It all depends.
How long does this start? I mean, you said could be from 1 hour or something, but from the time that they get it,
Honestly,
or is it different for everybody?
the virus itself, it causes like an immune response and an inflammatory response that people are doing okay for a couple of weeks. They're in the hospital, but they're on oxygen and just a minimal amount of support, but then their immune system goes into overdrive, and it turns into this horrible, I've had people that have been in my unit and then they've gotten a little better, so they get transferred out, and then they come back and they're 10 times worse. They think they're out of the whatever, and it turns into they end up intubated on a ventilator and dying. I've seen that many times. People that have been in the hospital for 3 weeks, we've gotten them past the COVID stage, you could say, because now after 10 days of being on COVID precautions, they can come off, but they're still very sick and dying.
Well, that's pretty sad. So it can turn either way, really.
Yeah,
And
I mean, I've seen people
last
that
a few days to months.
exactly. Sometimes it just depends on how your immune system and your body responds to it, and there's not a lot of data out there. There's more now than there was back in March, but there's not a lot of data to say, who's more susceptible. They say men have a worse time than women, and I've seen a lot of it where the Hispanic population seems like they've been getting hit hard. We've taken care of people that are Hispanic that are young and they're not that sick. Everyone's like, oh, you must have pre-existing conditions or comorbidities, and these people aren't that unhealthy, and they come in and they get super sick, and it's like, why?
Right? Yeah, they say comorbidity.
Comorbidity, yeah.
As being a nurse, you can say it much better than I can. And underlying conditions, have you seen a lot of that, of underlying conditions come through too?
Yeah, for some reason, diabetes is a big comorbidity that seems to, they get affected. People that are diabetic seem like they get affected worse. People with hypertension, things that you would think that wouldn't even make people that sick. Yes, that you're diabetic, but your lungs are fine, but you end up being sicker for some reason. It doesn't make any sense, but and with hypertension as well, there's data out there that says the virus affects certain hormone. I don't know if I want to say hormones or not, but certain things that your body produces that cause hypertension that also cause the virus to affect you more. So
does it affect your immune system?
Yeah.
Why?
It's crazy. I don't know.
It seems to travel throughout the whole body.
Yeah, this
diabetes.
isn't just a matter of, I hate when people who don't understand what this disease is doing just say, it's just the flu, because it's not. This virus affects blood clotting factors. It affects, iron binding factors in your blood. There's a lot more to this virus than influenza. Like, people are getting blood clots because this virus makes your blood clot easier. We see people that are having strokes because they've got this virus and they get super sick, and then come to find out they also threw blood clots and have had strokes because of this.
Wow, I didn't know that.
Yeah.
It's quite dangerous.
It is. I mean, that's why I feel that we need to be a little more just conscientious. You know, if you're not feeling well, don't go to work. You should be staying home. You know, if you're, you know, it sucks because it was the holidays and it seemed like everyone got sick and no one, you know, everyone wants to get together and it's hard to do that because they're telling us we really shouldn't. So.
Well, thank you very much for all that you have taught us. And there's things that you said that I didn't even know. Is there anything more that you want to add in the last couple of minutes?
No, I think just take it carefully. You know, as I said, if you're going to go out, wear a mask. The mask doesn't necessarily protect you, but it protects people from your germs. You know, I see people out there with gloves on, and gloves aren't really the best thing to wear because you think you're safe because you're wearing gloves, but you're touching everything with your gloves. So if you're gonna go out there, make sure you have Purell or hand sanitizer with you, and just, you know, we got to take it one day at a time because we don't know what is going to happen. You know, we're trying to eradicate this virus with a new vaccine, and you know, we don't know next year. Hopefully, you know, people get this vaccine and they take a little bit of some faith in science and not just what they see on social media, and take the vaccine so we can get ahead of this virus. So, yeah.
So thank you very much, Melissa. I'm sure this was very hard to talk about in some spots, especially all that you've seen. They really should have somebody for you to talk to so you don't have to bring it home.